yours, sir. The space is yours now, sir.
Assalamu alaikum. Good morning to all the young Unanians. When I was approached by Dr. Tanvi and Dr. Imam, so I wholeheartedly accepted this invitation because it gave me an opportunity to go back in my initial college days. So I think I suppose I have come from NEET, right?
Yes.
Yes, most of you are from NEET, yeah. So when you're coming from, yeah, that's good. Now, once you are into first couple of years of Unani, so you will be in too much confusion. Because even I have faced those confusions in my initial stages. Once you will come to know, okay, means once from the third year or second profession, once you complete, then once you are into the clinical side, the main interest in Unani develops because you will be practically seeing all the cases and you will be in interaction with the patient and directly one-to-one, you will get to know the responses of Unani medicine. So not going into much details, let me first explain you, okay, during our time, you people are lucky. It means in your first year, you are able to learn. It means Unani is just not restricted to India. It is out of India also, it is widely accepted. So starting, I will go with the UAE. So when we speak about this thing, acceptance abroad, what does it mean? So let me show some of the slides. Yeah. So this is UAE. Yeah, means what does UAE comprise of? So basically, Abu Dhabi is the capital of UAE, and this is Dubai. So although Abu Dhabi is capital, but UAE is popular by name of Dubai because Abu Dhabi is very rich because of its oil and all. But Dubai, it did not have any of its own resources or anything. So by attracting the tourists, to attract the tourists, Dubai had made a lot of iconic the buildings and all. You might have been knowing Burj Al Arab, Atlantis, Dubai fountains and all. So adjacent to Dubai, there is Sharjah. There are total 7 emirates. They are called states, or here it is called emirates. And India-wise, they are states. So Abu Dhabi is the capital. Then Dubai, adjacent to Dubai, almost 12 kilometers, it is Sharjah, then Ajman, then Al Quwain, Ras Al Khaimah, Fujairah. These are the 7 states which comprise of UAE. So once it was recognized in this thing in UAE, BUMS degrees in 2002 by the Ministry of Health, I got an opportunity to write the exam, and fortunately I passed the exam. So what does passing the exam means, or getting a license in an international platform? It means that once you get a license, you are eligible to practice in this country as any other medical doctor. So this was my first clinic. So my colleagues were on dermatology, ENT specialist, then this thing, dentist, and I was alternative medicine. As an alternative medicine specialty, any alternative medicine doctor can join. So this was my first exposure for in an international market. So when I joined here, so I did not knew means how to start the practice, and you will get a job until unless you are getting patient. That is very much important. So to get the patient, you need to be innovative. You should do something different, because the term Unani outside India, it is not means popular. But as this thing, as herbal medicine, it is popular. So when I started my practice, when the patients start coming, then the Arabs start telling their diseases on our humoral concept. That gave me confidence that, yeah, this is the place where Unani can be successful. So from there, my I started my practice. So then how to continue the practice without medicine? So in all over the world, you get all sort of herbal medicines. All the are readily available. So what I did is I took I searched for the herbals, and there in the first year, because I told you the first 2 years of your BUMS degree will be very crucial. So here, first 2 years are dry, but certain subjects are very interesting, and those in future, whenever you're planning to go abroad, they will be of very much. So Advya Mufrad, you will be studying in first year. That is simple herbs, single drugs, they are called. So those drugs all over the world, they are available. So that helped me a lot. No pharmaceutical company in any of this thing, they can't come and establish their products in international market for one person. So you need Advya Mufradat for identification and for use and all. They will be explaining by your teachers in the first year. Then in the second year, you will be going through compound medicine. That is there. The actual means you are not, you won't be dependent on the finished products of any companies, because once you are changing the country, you are supposed to, once you change the country, you are supposed to pass the exam, licensing exam of those countries. For medical stream only, it is like that. In other streams, if you go directly, you get a job. So, but why this? Anybody can tell him means why it is must for any medical graduate or any medical professional to clear the MOH exam or any licensing exam of that country, whereas others, they don't have this. Can anybody tell why you are supposed to pass the licensing exam of other countries to officially practice there?
It's authenticity. I think it's authenticity.
No, the thing is, means every country has their own diseases, which might not be in other countries. So you should have knowledge of the diseases which are prominent or present in those countries. So in India, we see malaria, typhoid, those type of diseases. Here in developed countries, they are not there. Here more of lifestyle diseases, and the other thing is means here, because this is desert basically, means all the Arabian countries. So like kidney stone, piles problem, and gastrointestinal problem, because everybody will be in stress, because everybody comes from their home country, stay, some people stay as bachelor, and some, everybody will have target, because lot of competition in each and every field. So that's why means you should know the diseases which are prominent in those countries. Like in I think in +2 intermediate, you might have studied about sleeping sickness and all, which is present in Africa. You don't find it in India. Yeah, so that's why to have the knowledge about the diseases of those countries. So that's why you are supposed to write the licensing exam. So once you pass the licensing exam abroad, when officially it is recognized, then you can practice your field like any other doctor, any MBBS doctor, because we compare with us with MBBS doctor. You can join any medical center, how they join, and along with them, shoulder to shoulder, you practice, but you are supposed to practice only your own field, that is Unani. So to practice Unani, so the first thing would be, okay, you should know means which all diseases Unani has good results compared to other system of medicine. So that will be very much crucial. So first of all, first 2 years, you will be learning about the preparation of medicine, means identification in the first year. Then after that, you go to second year, wherein you will learn how to prepare the compounds and all, like Majun, Jawarish, then all these things. So this will help, because whenever you are going abroad, because I will show in the other slides which all countries you can go and practice, you will be surprised to see that Unani is so widely accepted that in India, staying in India, we won't be knowing about it. So I started my practice initially. First, I got in Sharjah. There were 4 specialists. Then later, I of the country. Then you are officially been given permission to practice your system of medicine. So if you see, this is my business card hold. So I'm Unani practitioner with MOH and DOH registered. Means Ministry of Health and Department of Health licensed. So now it is called since 2014. Now it is called DHA, Dubai Health Authority licensing. So when officially you are there, you are practicing means you will be practicing how means any MBBS doctor or other specialists, dentist and all, they practice. So this is it. So means during our time, we did not know anything about such things. Means we can practice like this in officially abroad. So I practice here from 2004 to 2008. Then after this, during this period, 2004 to 2008, it was very crucial for me to promote Unani, to create awareness, because when you're first practitioner, even means in most of the states and all in India also, majority don't know properly what is Unani. Then you have to say about some manufacturing company name and all which are popular. So this comes under Unani system of medicine. So here I put lot of effort, and alhamdulillah, it started giving me results. So first I identified which all diseases I can promote in Unani system of medicine, which has quite good results. So I stressed on GI disturbances, they are quite popular, renal calculi, then hemorrhoids, piles problem, then sexual issues, then skin problem, vitiligo. All over the world, people are aware means Unani has excellent result, but all don't prefer coming to India. So Dubai had become a platform for all the means international means other Western people to come and take treatment here in Dubai. So this facility, once they started getting, and once the popularity grew, so I started means giving a lot of interviews for newspapers and all. This is one of my interview for Gulf News. Gulf News is the leading newspaper of UAE, which is widely read all over the world about Arab news. So in this here, my name and all. So this was on skin, because so my popularity for treating psoriasis, eczema, vitiligo, this grew. So one of one of my interview in this, which specify what is my qualification: Dr. Syed Asaduddin Ahmed, specialist in Unani medicine, a Greco-Arabic traditional branch of medicine. So from here, alhamdulillah, the popularity was such. Means a lot of health magazine. This is one of the health magazine in which this is about Unani. See, this is about Unani. Okay, in this means about acne I am speaking. Then this is Malayali magazine. It's called International Malayali. It was distributed all over this thing. 5-star hotels and flights of Kerala, means which fly to Kerala and from Kerala, UAE to any foreign countries. So much the acceptance was there. Means people started coming from all over the world. Now means in our clinic, 84 nationality, because 2018 we were nominated for health awards. So we had to give how many nationalities, and also when we have checked, 84 nationality of people, they come to Unani and get treated here for their ailments. So after Dubai, means from 2004 to 2008, I practiced in Dubai. Then I got one more license, because there are different initial stages. You get an first license to practice as an Unani practitioner. So after that, means to upgrade it, means if you are changing the state or Emirates, then there are different licenses. Previously it was only additional license to practice in Dubai. All